15 daily habits that can slowly cause you to have a stroke. Stroke doesn't happen overnight. It's built silently day by habits you think are harmless. The scariest part is that you're probably doing them right now without knowing. I can tell you that most strokes are not only predictable but are preventable. Welcome to Meddling Talks. My name is Dr. Kabongo, and today I'm going to walk you through 15 everyday habits that silently increase your risk of stroke, and more importantly, how to reverse them. Before getting into these 15 habits, it is important to understand how stroke develops. A stroke happens when the brain suddenly stops receiving the blood and oxygen it needs to function. This can occur in two main ways. Either a blood vessel becomes blocked by a clot, ischemic stroke, or it bursts due to weakness in the vessel wall, hemorrhagic stroke. In both cases, brain cells which are extremely sensitive to lack of oxygen start dying rapidly. Researchers determined that in a stroke, the brain is losing nearly 2 million neurons every minute. That's why every second counts. Over time, everyday habits like living with high blood pressure, poor diet, smoking, and inactivity gradually damage and narrow these blood vessels, making them more likely to clot or rupture. In simple terms, a stroke is often the final result of years of silent damage to the brain's blood supply. In my 2+ decades of practicing family medicine, I have helped many of my patients improve their metabolic health. I would like to share this experience with you in today's video. Without further delay, these are the daily 15 habits that can tremendously increase your risk of stroke. Habit 1. Living with chronic uncontrolled high blood pressure. This usually happens when people neglect regular checkups or they just choose to ignore medical advices. Unknowingly, your blood pressure is silently damaging your brain. The problem is that most people feel nothing until it's too late. That's why high blood pressure is called silent killer. But how can elevated blood pressure cause a stroke? It is important to underline that hypertension is not an isolated disease. Though researchers have proven that, taken individually, hypertension is a single worst predictor of stroke and other cardiovascular complications, elevated blood pressure happens in a continuum. This continuum follows this chronological path. 1. Poor diet. 2. Elevated blood sugar. 3. Elevated insulin production. 4. Obesity, especially abdominal. 5. Chronic low-grade inflammation. 6. Elevated bad cholesterol. 7. Elevated blood pressure. High pressure damages blood vessels, making them stiff, narrow, and prone to rupture. Practical advice. 1. Have a good diet that prevents continuous elevation of blood sugar. Most importantly, diet that can decrease inflammation. We are going to discuss this later in this video, and I will give you 5 fantastic and practical tricks that you can use to spot and quickly tell if a food in a shelf at the supermarket is worth picking or totally avoidable. 2. Remain active. 3. Reduce salt. 4. Monitor your blood pressure regularly, preferably having your own blood pressure machine for regular blood pressure checks. The new 2025 Canadian Guidelines on Hypertension determines which equipment to use, how and how often to check, and the mistakes to avoid while measuring the blood pressure. I do have a dedicated video analyzing and summarizing these new guidelines that I am going to link to this video for your information. The big insight is that high blood pressure is the #1 cause of stroke, and it's often silent. Habit 2. Smoking, even occasionally. Big question. Can just one cigarette really hurt you? The problem is that people underestimate effects of even occasional smoking. In a prospective cohort study published in The Lancet in 2005, 1.1 million people were followed up over time. The study found that smoking significantly increases the risk of both ischemic and hemorrhagic stroke. The more a person smokes, the higher their risk. Heavy smokers can have up to twice the risk of stroke compared to non-smokers. Quitting smoking reduces stroke risk substantially over time. Medical explanation. Smoking damages vessel walls and increases clot formation. Practical advice. There is no safe level. Complete cessation is key. Every cigarette is a direct attack on your blood vessels. Habit 3. Living a sedentary lifestyle. Big question. Is sitting the new smoking? Problem? Long hours of inactivity slow down your blood circulation. Reduced blood flow increases clot risk and metabolic dysfunction. Your body is designed to move. Stillness promotes diseases, confirming what the Chinese believes that every disease is caused by non-progression of the body energy. Practical advice. 1. The 30-30 rule. For every 30 minutes of sitting, have 30 to 60 seconds of movement. Easy options. Stand up plus walk a few steps. Do 10 calf raises. March in place. 2. Activate the second heart, your calves. Especially important for long-sitting travel desk work. Your calf muscles act as a venous pump. Do this daily. Heel raises 20 reps x 3-day. Toe lifts while seated. Ankle circles. 3. Turn sitting into active sitting, even while seated. Tighten thighs 5-10 seconds holds. Lift one leg at a time. Tap feet rhythmically. 4. Movement snacks better than one big workout. Instead of one long session, do multiple mini sessions. 3 to 5 minutes every hour. Walk while on phone. Take stairs whenever possible. If so far you find this video informative, please subscribe and activate the notification bell so you don't miss similar video like this one in the future. Habit 4. Having processed food diet. Big question, is your food slowly poisoning your arteries? The problem lies with hidden salt, sugar, and unhealthy fats. How can having processed food diet cause stroke? Processed food lead to inflammation, plaque buildup, and hypertension. Practical advice. Eat an anti-inflammatory diet essentially made of the following: fresh fruits and vegetables, healthy fats from sources like olive oil, nuts, and avocado, fatty fish such as salmon or mackerel, herbs and spices like turmeric, ginger, and garlic can also help. Swap refined grains for whole grains, limit red and processed meats, and reduce added sugars. The question usually asked is how to recognize ultra-processed food, how to spot them on the shelves. To answer this question, here are 2 quick question tests to ask yourself. A. Would I find this food in a kitchen or a factory? B. Could I recreate this at home? If the answer to these 2 questions is no, it is likely ultra-processed food and should be avoided. Here are some hints how you can spot ultra-processed food from the shelves.
The 5 practical tricks to identify ultra-processed foods.
Use them whenever shopping to decide if you have even to pick an item, have to pay for it, or simply return it on the shelf.
1.
Marketing claims usually on a very attractive multicolor packaging. This is usually a warning sign. Then look for claims like low fat, sugar-free, high protein, healthy snack. 2. Long ingredient list. More than 5 or 7 ingredients. Hard to pronounce names. 3. Chemical sounding ingredients. Look for qualifiers like emulsifiers, stabilizers, artificial colors, flavors. If it sounds like a lab, it probably is. 4. Hidden sugars everywhere. Examples: glucose syrup, fructose, maltodextrin. 5. Ready to eat, hyper convenient, instant meals, packaged snacks, sugary cereals. 5. Living with a poorly controlled diabetes. The big question is, what is sugar doing to your blood vessels? How poorly controlled diabetes can lead to stroke? This is the medical explanation. 1. High blood sugar damages your blood vessels. 2. Over time, excess sugar in the blood weakens and injures the walls of blood vessels. 3. Arteries become narrow and stiff. This damage leads to buildup of fatty deposits, reducing blood flow to the brain. 4. Blood becomes more likely to clot. Diabetes makes the blood stickier, increasing the risk of clot formation. 5. Clots can block blood flow to the brain and cause a stroke. 6. Often occurs with other risk factors like high blood pressure and high cholesterol. The big insight is that diabetes silently ages your blood vessels. 6. Excessive alcohol consumption. The big question: is your relaxation drink increasing your risk of stroke? Problem: regular excess raises blood pressure. But how excess alcohol consumption can lead to stroke? Excess alcohol raises blood pressure. Drinking too much alcohol increases blood pressure, which is the leading risk factor for stroke. Weakens and damages blood vessels. Over time, alcohol can make blood vessels less flexible and more prone to rupture or blockage. Increases risk of irregular heart rhythm. Heavy drinking can directly irritate your heart and interferes with the signals that controls your heartbeats. This can trigger abnormal heart rhythms, like atrial fibrillation, which can lead to clot formation. In addition, alcohol lowers key minerals, electrolytes, such as potassium and magnesium, which are essential for a steady heart rhythm. You have heard about condition like holiday heart, which refers to a temporary heart rhythm disturbance, most commonly atrial fibrillation, that occurs after heavy or binge alcohol consumption, often during weekends, vacations, or festive periods. Promotes clot formation. Alcohol can disturb the balance of clotting, making it easier for clots to form and travel to the brain. Contributes to weight gain and poor metabolic health. Practical advice: moderation or elimination if at risk. 7. Living with chronic stress.
Big question.
Can stress damage your brain?
Problem.
Constant stress keeps your body in survival mode. How chronic stress can lead to stroke? Stress raises blood pressure over time. Ongoing stress keeps the body in fight or flight mode, which increases blood pressure, a major risk factor for stroke. Damages blood vessels. Stress hormones, like cortisol, can injure and stiffen blood vessels, making them more prone to narrowing or rupture. Promotes inflammation and plaque buildup. Chronic stress contributes to the gradual clogging of arteries, reducing blood flow to the brain. Increases risk of unhealthy coping habits. People under stress may smoke, drink excessively, eat poorly, or become inactive, all of which raise stroke risk. Disrupts heart rhythm and sleep. Stress can trigger abnormal heart rhythms and poor sleep, both linked to higher stroke risk. That's why in our movement called Homestead Education, stress management is the fourth pillar of the management framework of all chronic diseases. This can be achieved through various modalities such as breathing, prayer, rest, counseling. We have to remember that. Unmanaged stress becomes biological damage. Diet, obesity, and abdominal fat. The big question is belly fat more dangerous than you think? The brutal and sad reality is that visceral obesity, this fat tissue accumulating between and around your internal organs, once perceived as an external sign of financial stability, still culturally accepted and preferred in certain parts of the world, is the worst form of obesity compared to all other forms or places where fat accumulates in our body. But how abdominal visceral obesity can lead to stroke? Fat around the organs is hormonally active. Belly fat is not just storage, it releases harmful substances that promote inflammation and damage blood vessels. Raises blood pressure. Visceral fat increases pressure in the blood vessels, a major risk factor for stroke. Disrupts blood sugar control. It contributes to insulin resistance and can lead to type 2 diabetes, which damages arteries over time. Increases bad cholesterol and plaque buildup. This leads to narrowing and hardening of arteries, reducing blood flow to the brain. Promotes clot formation. Visceral obesity makes the blood more prone to clotting, increasing the risk of blockage in brain vessels. Practical advice: focus on sustainable weight loss. Regularly measure not only your weight, but also your abdominal circumference. Anything above 102 centimeters, 40 inches in males, or 88 centimeters, 35 inches in females. In some high-risk populations, such as Asians, lower cutoffs are used. Men, 90 centimeters, 35 inches. Women, 80 centimeters, 31.5 inches. Should alert you. Big insight. Not all fat is equal. Abdominal fat is high risk. Poor sleep. The big question is, can lack of sleep trigger a stroke? Poor sleep is not just fatigue. It stresses your entire body. When you regularly sleep too little or have poor quality sleep, your body stays in a constant stress mode, releasing hormones like cortisol that raise blood pressure over time. It increases blood pressure, a major stroke risk. During healthy sleep, blood pressure naturally drops. With poor sleep, this recovery doesn't happen, leading to persistently higher blood pressure, one of the strongest risk factors for stroke. It disrupts blood sugar and metabolism. Lack of sleep makes your body less sensitive to insulin, increasing the risk of diabetes, another key contributor to stroke. It promotes inflammation in blood vessels. Poor sleep triggers chronic low-grade inflammation, which can damage blood vessels and make them more prone to blockage or rupture. It raises the risk of dangerous heart rhythms. Sleep problems, especially conditions like sleep apnea, can lead to irregular heart rhythms such as atrial fibrillation, which can cause blood clots that travel to the brain and trigger a stroke. It contributes to weight gain and unhealthy habits. Tired individuals are more likely to overeat, crave sugary foods, and be less physically active, all of which increase stroke risk. Practical advice: aim for 7 to 8 hours of quality sleep. Sleep is not rest, it's repair. Not drinking enough water. Cannot drinking enough water be dangerous and even be a risk for a stroke? The problem is that many people live in chronic dehydration. But how dehydration can contribute to the development of strokes? Here is medical explanation. Dehydration. 1. Thickens your blood. When you don't drink enough water, the amount of fluid in your blood decreases, making it thicker and more sticky, which increases the risk of clot formation. 2. It increases the risk of blood clots. Thicker blood flows more slowly and is more likely to form clots that can block blood vessels in the brain, a direct cause of stroke. 3. It lowers blood pressure and reduces brain perfusion. Severe dehydration can reduce blood volume, leading to lower blood pressure and less blood flow to the brain, which can trigger certain types of stroke. 4. It disrupts electrolyte balance. Dehydration affects important minerals like sodium and potassium, which are essential for normal heart rhythm and blood vessel function. 5. It can trigger dangerous heart rhythm problems. In some cases, dehydration may contribute to irregular heart rhythms such as atrial fibrillation, which can lead to clot formation and increased stroke risk. Practical advice: drink water consistently throughout the day. A glass of water should be first thing to be done in the morning in order to correct dehydration that happens during sleep. Water is not optional, it's circulation. Ignoring warning signs. The big question is, would you recognize a mini stroke? Medically called a transient ischemic attack, is a temporary blockage of blood flow to the brain that causes stroke-like symptoms but does not lead to permanent damage. Symptoms usually last a few minutes to hours and then fully resolve. But it is a serious warning sign of a future stroke and requires urgent medical attention. When a TIA happens, the risk of a major stroke is highest in the first 48 hours. And up to 1 in 10 people may have a stroke within days. Over time, as many as 1 in 3 people can go on to have a full stroke if nothing is done. The problem is that symptoms are often dismissed or unrecognized. Practical advice: act fast, recognizing stroke quickly. This is a practical mnemonic to be used if you suspect stroke. Face drooping. Ask the person to smile. Does one side of the face droop or look uneven? Arm weakness. Ask them to raise both arms. Does one arm drift downward or feel weak? The speech difficulty. Ask them to repeat a simple sentence. Is their speech slurred, confused, or hard to understand? Time to call emergency services. If you notice any of these signs, call emergency services immediately. Every minute counts. Early treatment can save brain function and life. Having untreated sleep apnea. Big question: is your snoring dangerous? The problem is that it causes interrupted breathing at night, which leads to oxygen drops and high blood pressure. One of the most important studies published in the New England Journal of Medicine showed interesting results. This study was a large prospective cohort of over 1,000 patients followed over time, and it found that people with obstructive sleep apnea had about twice the risk of stroke or death compared to those without it. Even after adjusting for major risk factors like hypertension, diabetes, smoking, the risk remained significantly higher, hazard ratio 1.97. The more severe the sleep apnea, the higher the risk of stroke. Dose-response relationship. Practical advice: get evaluated if you snore heavily. Sleep apnea silently stresses your heart and brain. Having poor air quality, air pollution. Big question: can the air you breathe harm your brain? The problem is that invisible toxins in the environment can still harm and destroy our cardiovascular health. Medical explanation: air pollution damages your blood vessels. Tiny particles in polluted air, like traffic fumes and smoke, can enter your bloodstream through the lungs, irritating and damaging the inner lining of your blood vessels. It triggers inflammation in the body. Pollution causes chronic low-grade inflammation, which makes blood vessels narrower and more prone to blockage. It increases blood pressure. Regular exposure to polluted air has been linked to higher blood pressure, one of the strongest risk factors for stroke. It makes blood more likely to clot. Pollutants can increase blood stickiness, raising the risk of clots forming and blocking blood flow to the brain. It worsens heart and lung conditions. Air pollution can aggravate diseases like hypertension and chronic obstructive pulmonary disease, both of which increase stroke risk. Even short-term exposure can be dangerous. Studies show that spikes in air pollution, for example on high smog days, are linked to a higher number of strokes within hours to days. The BMJ meta-analysis found that short-term increases in air pollution, especially fine particles, are associated with a significant rise in stroke admissions and deaths within hours to days. The Lancet Neurology Global Burden of Disease study identified air pollution as one of the leading modifiable risk factors for stroke worldwide, contributing substantially to stroke incidence and mortality. Practical advice: limit exposure, improve indoor air quality. Big insight: your environment shapes your health. Being socially isolated. Big question: can loneliness affect your physical health? How does social isolation raise your risk of developing stroke and even its outcome? Social isolation increases stress levels. When people feel lonely or disconnected, the body produces more stress hormones like cortisol, which over time can raise blood pressure and damage blood vessels. It raises the risk of high blood pressure. Chronic loneliness has been linked to higher rates of hypertension, one of the strongest risk factors for stroke. It promotes unhealthy lifestyle habits. People who are socially isolated are more likely to smoke, eat poorly, be less physically active, and have poor sleep, all of which increase stroke risk. It contributes to depression and poor mental health. Conditions like depression can lead to reduced motivation for self-care, medication non-adherence, and worsening of cardiovascular risk factors. It increases inflammation in the body. Loneliness has been associated with chronic low-grade inflammation, which can damage blood vessels and promote clot formation. It delays seeking medical help. Socially isolated individuals may be less likely to recognize symptoms early or seek urgent care, increasing the severity and consequences of stroke. A systematic review and meta-analysis, BMC Public Health 24, published in 2024, clearly showed that poor social relationships, including social isolation and loneliness, are associated with a 30% increased risk of stroke and also linked to higher mortality after stroke. A large meta-analysis led by Julian Holt-Lundstad in 2010, which examined the effect of social relationships on mortality, concluded that people with poor social relationships had about a 50% increased risk of early death. This level of risk is comparable to major risk factors such as smoking, obesity, and physical inactivity. Hence this popular statement. Long-term social isolation is comparable to smoking up to 15 cigarettes per day in terms of increased risk of early death. Practical advice. Build and maintain meaningful relationships. Is this what pushed the UK government to create in 2018 the Ministry of Loneliness? Connection is protective medicine. Recreational drug use. Big question. Can one use be enough to trigger a stroke? Problem. Often underestimated risk. How can drug use and abuse increase your risk of suffering stroke? 1. Drugs can sharply raise blood pressure. Many substances, like stimulants, cause a sudden spike in blood pressure, which can damage blood vessels in the brain and increase the risk of a stroke. 2. They can cause blood vessels to tighten or spasm. Some drugs make brain arteries suddenly narrow, reducing blood flow and potentially triggering an ischemic stroke. 3. They increase the risk of bleeding in the brain. Certain drugs weaken blood vessel walls, making them more likely to rupture and cause a hemorrhagic stroke. 4. They promote blood clot formation. Drug use can make blood more prone to clotting, increasing the chance of a blockage in a brain artery. 5. They can trigger dangerous heart rhythm problems. Some substances can lead to irregular heartbeats such as atrial fibrillation, which can form clots that travel to the brain. 6. They increase the risk of infections affecting the heart. Injected drugs can lead to infections like endocarditis, which can send clots to the brain and cause stroke. 7. They often come with risky lifestyle patterns. Drug abuse is frequently associated with poor nutrition, dehydration, and lack of medical care, all of which further increase stroke risk. Practical advice. Avoid completely, as even single use can be fatal. Before I let you go, let's review and put together what we have learned today about the 15 everyday habits that silently increase your risk of stroke. 1. Living with chronic uncontrolled high blood pressure. 2. Smoking. 3. Leading incidentally lifestyle. 4. Having a processed food diet. 5. Living with a poorly controlled diabetes. 6. Excessive alcohol consumption. 7. Living with chronic stress. 8. Being obese, especially with a big belly. 9. Poor sleep habits. 10. Not drinking enough water. 11. Ignoring warning signs. 12. Having untreated sleep apnea. 13. Having poor air quality. 14. Being socially isolated. 15. Use of recreational drugs. In conclusion, a stroke doesn't usually happen overnight. It is the result of years of small, repeated habits. The good news? The same way habits can destroy your health, they can also rebuild it. Start small. Change one habit today. If you have not, please subscribe to the channel, like, and share this video with someone who is trying to improve their metabolic health. And as always, stay curious, stay informed, and take care of your health. See you in the next video.